The next skill is administering medications via a gastric tube. First, you would gather the equipment, check the medication order, clarify any inconsistencies, and check the patient's health record for allergies. Know the actions, nursing considerations, safe dose ranges, purpose of administration, and adverse effects of the medication. Perform hand hygiene. Move the medication supply system to the outside of the patient's room or prepare for administration at the medication supply system. Unlock the system drawer. Enter the passcode into the computer and scan employee identification. Prepare medications for only one patient at a time. Read the MAR and select proper medication. Compare the label with the MAR. Check to see if the medication can come in a liquid form. If pills or capsules are to be given, check with pharmacy or drug reference to verify the availability to crush the tablets or open capsules. Prepare the medication. For a pill, use a pill crusher. Crush each pill one at a time and dissolve the powder with water or other recommended solutions. For a liquid, when pouring liquid medications from a multi-dose bottle, hold the bottle with the label against your palm. Use the appropriate measuring device when pouring the liquids and read the amount of medication at the bottom of the meniscus at eye level. Depending on the facility policy, the third check of the label may occur at this point. Replace any multi-dose containers in the patient's drawer or medication supply system. Lock the medication supply system before leaving. Ensure that the patient receives the medications at the correct time. Perform hand hygiene and, if necessary, put proper PPE on. Identify the patient and compare the information with the MAR. The patient should be identified using at least two methods, the identification band, the number on the band, or ask the patient to state the name and date of birth. Complete necessary assessments before administering medications. Scan the patient's barcode on the identification band if it's required. Based on the facility policy, the third check may be occurring at this point. You should then assist the patient to high Fowler's position unless it's contraindicated. Put on gloves. If the patient is receiving continuous feedings, pause the tube feeding pump. Pour the water into the irrigation container. Measure 30 mLs of water. Apply the clamp on the feeding tube if present. Next, you would check the tube placement depending on the type of tube and facility policy. Note the amount of any residual. Replace the residual back into the stomach based on the facility policy. Apply a clamp on feeding tube if present. Alternatively, pinch the gastric tube below port with the fingers or position the stopcock to the correct direction. Unclamp the tube and allow the water to enter the stomach via gravity infusion. Administer the first dose of medication by pouring into the syringe. Follow with 5 to 10 mLs of water flush between the medication dosages. Follow the last dose with 30 to 60 mLs of water flush. Clamp the tube, remove the syringe, and replace the feeding tubing. If a stopcock is used, position in the correct direction. Remove your gloves and assist the patient to a comfortable position. If the patient is receiving a tube feeding, the head of the bed must remain elevated at least 30 degrees. Remove your PPE if used. Perform hand hygiene. Document the administration of the medication immediately after administration, and continuously evaluate the patient's response to the medication within the appropriate time frame.